Hi everyone, this is the Team 5 presentation. Today we're diving into the world of transhumanism. So, what is transhumanism? Transhumanism is a movement that believes we can use advanced technology to go beyond our natural limits of our bodies and minds. Think of it as the next step in human evolution, where biology meets technology. So, what does that really mean? Transhumanism is all about overcoming human limitations, whether physical, mental, or even emotional, by using science and technology. The main idea is not just to fix what's broken, but to enhance what we already have. There are three big principles that guide this movement. Integration of technology, such as artificial intelligence, biotechnology, and nanotechnology. Improving quality of life, so people can live healthier, more capable lives. And extending lifespan, with the hope of slowing down or even reverse aging. We have a few examples. First is cognitive enhancement. Stuff like researchers are developing brain-computer interfaces, or BCIs, that can improve memory and learning. Imagine controlling a computer or smartphone just by thinking. Companies are already testing neural implants to make this possible. Second, we have physical augmentation. This is about giving our bodies new abilities. Advanced prosthetics and robotics exoskeletons are helping people walk again, regain strength, and even exceed natural limits. Some bionic limbs can now provide sensory feedback, meaning users can actually feel textures or pressure through their prosthetic hands. And the third example we have is longevity and anti-aging. This is perhaps the most ambitious goal of transhumanism, and it's extending human life. Genetic engineering techniques like CRISPR are being explored to slow down aging and fight age-related diseases. While it's still early, these breakthroughs could dramatically change how long and how well we live. So, while transhumanism raises big questions about identity, equity, and ethics, it is also a very real and immediate impacts in healthcare. To explore how these principles are shaping medicine today, from regenerative therapies to nanotechnologies, I'll hand it over to Leo, who will dive into transhumanist medicine.
So, I'll be discussing the medical side of transhumanism. Transhumanist medicine is about applying transhumanist principles, so things like enhancement, longevity, and optimization to healthcare. And the goal isn't just to treat illness, but to revolutionize how we prevent and cure diseases as well. And the first three, there are three major areas where transhumanist principles show up. The first is regenerative medicine. Regenerative medicine. This includes things like tissue engineering, where we can grow or repair tissues and replace what the body has lost and cannot repair by itself. So, if we take examples like burn victims or people with damaged heart tissue, generally the body cannot replace skin tissue if it's been damaged to a massive extent, like third-degree burns, or it cannot regenerate its own heart. So we would use lab-grown tissue rather than doing a risky and invasive transplant. And the second part is synthetic biology, and this focuses on creating artificial organs or even artificial blood, which I'll explain more on the next slide. But these kinds of technologies could mean we're no longer limited by organ shortages or donor compatibility. And the third is nanomedicine. So this is using nanoscale particles or machines to deliver drugs with really, really accurate precision. Um, so instead of doing something like chemotherapy, where you damage the whole body to get rid of an invasive cell, using nanobots to just target specific cancer cells would be a lot more um, useful and have a generally higher rate of success. So, overall, transhumanist medicine reimagines healthcare and it doesn't really fix problems as much as it upgrades the human body. So, one of the most fascinating examples of synthetic biology is synthetic blood. Synthetic blood is the artificial substitute designed to carry oxygen and do the job of real blood, but it isn't. Some examples are hemoglobin based oxygen carriers, those are called HbOCs, and perfluorocarbon based substitutes. There are several benefits to this. First is universal compatibility. That means there's no more worrying about blood types, and kind of like having O negative, you can kind of just put it in anybody and it will generally, the body will accept it. And a second benefit is that synthetic blood has a much longer shelf life than donated blood, and it can reduce infection risk. This is massively useful in emergencies, something like a mass casualty event when people come in and there's a shortage of blood, especially in places that don't have access to safe blood donations. And the third is there's a potential for enhanced oxygen delivery. So there's cases where synthetic blood will do a better job at carrying oxygen and nutrients than natural blood. There are challenges. So there are toxicity and safety concerns. So there's very strict regulatory hurdles before widespread adoption of synthetic blood can be carried out. And as of 2019, it's not a it wasn't in common clinical use. So the potential is very incredible, but the road to making it safe and practical is still ongoing. Finally, let's look at some advanced applications and where transhumanist medicine is headed in the future. So, one massive area is bioengineered organs. We can use 3D like printed and patients' own cells in combination to create personalized organs that can reduce the risk of rejection. So, as you know, with any transplant operation, there is massive waiting times to find the appropriate donor when that new organ could just be printed on demand. Another breakthrough is neural interfaces or brain computer interfaces. These are being developed to restore motor function in people with paralysis or to even treat neurological disorders like epilepsy. I'm sure you've all seen the Neuralink things that, you know, Elon Musk is doing, kind of like that. So this would blur the line between biology and technology. Gene therapies are also a very central focus of transhumanist research. These allow us to target specific genetic diseases and, in some cases, even boost resilience against environmental stressors like toxins or viruses. This would be massively helpful in places that don't have very good vaccine adoptions, so more third world countries. This is a much potentially cheaper and more widely accessible uh, route to go. We need to look to the future. The future potential is massive for transhumanist technology. Personalized medicine is where treatments are tailored to each person's unique genetics rather than one size fits all, which is kind of what we have to do right now because research is not unlimited. And the integration of AI into healthcare. So think of things like wearable devices or implants that can monitor your health in real time and make adjustments instantly. There is a massive debate going on whether that is humane and ethical, and the road to AI integration needs to be incredibly monitored and we need to make sure that it's not taken advantage of. So, in short, transhumanist medicine holds the potential promise of moving us from reactive healthcare to proactive healthcare and even enhancement focused medicine. The big questions aren't just about the science, but about the ethics as well. So, how far should we go in enhancing human capabilities instead of how far can we go? Is probably the question I would lean towards.
We have just gone over some exciting transhumanist technologies. like synthetic blood and bioengineered organs, but now we need to dig into the serious ethical and social issues they bring up. These are the big deal. These are a big deal to make sure that these advancements help people fairly. First, accessibility. Who is going to get these advancements? Right now, things like neural implants and gene therapies are expensive and mostly available in places with strong healthcare systems. If only rich people can afford to boost their brain or live longer, we could end up with a really unequal world. Governments and companies should team up to offer funding or programs to make things like synthetic blood, which works for all blood types, available to more people, especially in areas with less healthcare. Next is fairness. These technologies can make society less equal. For example, someone with a bionic limb or anti-aging treatment might get a big edge in jobs or sports. People who can't afford upgrades could get left behind. We need rules, maybe from governments or groups like the World Health Organization to keep things fair. CRISPR edits, for instance, could give some people lifelong health benefits. So we need to make sure that they don't just help a small group. Safety is another huge issue. These technologies are new and they can be risky. Synthetic blood has problems with toxicity, like we mentioned earlier, and brain computer interfaces could be hacked. We need careful testing and strong rules to keep people safe. Think about how long it took to make organ transplants and vaccines safe. Years and years of work went into that, and we need the same level of precaution here. Then there's the big debate, good versus the bad. On one side, transhumanism could wipe out diseases like cancer or Alzheimer and let us live longer, healthier lives. It's amazing. But some worry it can make us less human. If we are all using tech like neural implants, will we still feel like ourselves? Or will we feel pressure to upgrade just to fit in? We need scientists, philosophers, and regular people to talk this out to stay on the right path. Some of the key discussion questions that we faced were presented here, and we'd love to go over them now, although we don't have a direct answer for you. First, if we merge with machines or enhance our biology, does it change our sense of human dignity and identity? For example, if we use brain-computer interfaces to control devices or boost memory like we talked about, do we still feel human? Does adding tech to our bodies like synthetic blood or neural implants make us less connected to our natural selves? This question pushes us to think about what dignity means and whether enhancements might challenge how we see ourselves or others. Second, how can we distinguish between legitimate medical treatments and enhancements that go beyond them, and who should make that decision? Bioengineered organs. If they're used to save someone's life, that's clearly medical. But what about using CRISPR to make someone smarter or stronger? Where is the line? Should doctors decide, or should it be up to governments, ethicists, or even the public? This matters because it affects how we use technologies like gene therapies fairly and responsibly. Another great question that we faced was, even if these technologies are safe and accessible, is it morally right to use them for augmentation instead of just healing? For instance, synthetic blood could save lives in emergencies, but what if it's used to make athletes perform better? Is it okay to go beyond fixing problems to make people better than natural? This question asks us to weigh whether enhancing ourselves, like with bionic limbs for extra strength, is ethical, or if we should stick to just using tech to heal people. To wrap up, the project has taken a deep dive into transhumanism, and it's clear this movement could reshape what it means to be human. Let's look back at the big picture. Transhumanism is about using technologies like AI, biotechnology, and nanotechnology to push past our natural limits. We've seen examples happening now, like brain computer interfaces that improve memory or let people control devices with their minds, bionic limbs that give new strength, and gene therapies that can reduce aging. In medicine, transhumanism is a game changer. Synthetic blood could solve blood shortages with its universal compatibility and long shelf life, while bioengineered organs could make transplants safer by reducing rejection. These advancements point to a future where we don't just treat diseases but prevent them, maybe even using AI to keep track of our health in real time. But it's not all straightforward. The ethical issues we covered, access, fairness, safety, and the worry about losing our human identity are huge challenges. If we don't address them, we could end up with a world where only a few benefit, or we lose what makes us human. That's where our key questions come in. We need to think hard about whether merging with machines changes our dignity, how to separate medical treatments from enhancements, and if it's right to use these technologies to go beyond healing. These questions push us to plan carefully, involving scientists, ethicists, policymakers, and communities to make sure transhumanism works for everyone. In the end, transhumanism offers an incredible chance to make life better, longer, and healthier. But only if we handle it with care. It's about balancing the huge potential like curing diseases and extending lives, the responsibility to keep things fair, safe, and human. Thank you for listening to Team 5.